So, throughout human history, as far as we know, recorded human history at least, people have always been resilient. They've had this capability to, you might say, rise beyond their circumstances, or their situations, or their past. And because we haven't really had a principle-based way to understand that, let's just say, I can say that here in this group, then we've had a confusion. And that confusion has pointed us in the wrong direction. So let me give you an example of that, because there are many examples of it, but here's a convenient one. 1847, women were dying of childbirth. 10% of women died in childbirth. 10%, so that's 1 in 10. Terrible thing, terrible condition. Was unknown. Well, no, it was known what the problem, what caused it. If you go to the medical text at the time, which I have, it explained it. There were a number of different causes. Curdled mother's milk. That was one of the causes. The birth position was another factor. The personality of the mother. It's always the personality of the mother, isn't it? You know, it's a convenient. Well, it must be the personality of the mother. That was Freud's answer, anyway. The atmosphere of the hospitals. It was so thought that the atmosphere was such a problem that they were drawing up plans that in the future all hospitals where women gave birth would be the maximum of 2 beds. Can you imagine? And furthermore, they had to be downwind of one another. So the atmosphere from one birth unit the wind or the air from one unit wouldn't transfer to the other, because that could mean mortality for the mother. So what happened was, as you may have suspected, none of those causes were accurate. They were actually not causal at all. One gentleman in Hungary, he was puzzled by this because he had a unit right next door to him was the midwifery unit. And in his unit, women rotated either admission onto his medical unit or the midwifery unit. Mondays, medical unit. Tuesdays, midwifery unit. Wednesdays, medical units. It always rotated like that. So there was a random selection of mothers. He happened to ask the director of the midwifery unit what the mortality rate of mothers were from this disease that was called childbed fever. And she said, well, it's about 1%. And he said, oh, excuse me, I don't think you understood my question. She says, no, 1%. And on his side of the wall, there was just a wall separating them, it was 10%. So he had 10 times the death rate of this disease on his side of the wall, with randomly selected mothers coming in. And it really puzzled him. Not puzzled him, it obsessed him. He couldn't imagine why his medical unit was killing 10 times the mothers of the midwifery unit. And you can imagine what a horrible news that would be. He stayed up all night, he studied books, he studied all these medical textbooks. By chance, he got burned out. And his good friend, his name was Semmelweis, his good friend was Kolechka. Kolechka says to Semmelweis, you got to take a break. go to Vienna, have 3 weeks off, just relax. You got to get away from this. You're driving yourself crazy with this childbed fever thing. So he takes a break, and he doesn't get any rest. He reads textbooks all the time he's gone. He's still obsessed by this. It's so horrible. What's happening? He comes back. He's back in the autopsy room. They would do autopsies on, there was a lot of mothers coming through this hospital. So every morning there were dead mothers to do autopsies on. Another wave. And he's doing another batch of autopsies, and he's waiting for Kolechka to show up. The attendant comes in. He says, where's Kolechka? I need his help. And the attendant is kind of white. And he said, what? And he said, you don't know the news? And he said, what news? He said, Kolechka's dead. He said, oh my God, what happened? He said, I don't know. He got a fever, and he went into delirium, and in 3 days he was dead. It broke his heart, broke Semmelweis's heart. He couldn't really finish his autopsy. He goes up to read the medical records of his friend Kolechka's autopsy. And when he read his autopsy, he noticed that the same conditions that was killing all the mothers in his unit, Kolechka had. He died of the same general types of symptoms. In other words, a male surgeon died of childbed fever. But he knew, right there, this is telling me something. There's something deeper going on here than childbirth. Well, he knew, and then he read further. There's a little note in the autopsy that said, about a week before Dr. Kolechka was nicked in the arm during an autopsy by a clumsy medical student. And he makes the logical assumption there must have been some material on that scalpel. And he discovers germs right there. And that changed the world. Changed medicine, changed our health care, it changed everything. Slowly. It wasn't overnight, because it was very difficult to get this comprehended. But it was the beginning of what's known as germ theory was not known until that moment, and thereafter suspected, at least. So he goes down, he puts a notice on the entry to the operating rooms, because we would find out later, he would find out, this didn't just only pertain to childbed fever, but it also pertained to wound fever, it also pertained to fever from surgeries. Half the people that had surgeries died, and they all died of fever. And fever caused by, here's what was happening. The surgeons would do autopsies in the morning. There was no morgue on the midwifery unit, you see. It was just the physicians doing autopsies. So they would do their autopsies and then wipe their hands on their aprons and put their scalpels in their pocket and go right down the other end of the hall and go into the operating room, take the scalpels out, and deliver babies. Well, I can hear moans in the crowd like, oh my God, you know. This wasn't that long ago, 1847. You don't have to go back very many generations in your family to find someone living in 1847. My great-grandfather was living in 1840, and I met him, I knew him. So that's not that long ago. So this discovery found a deeper order. It found something that was always there. Germs had been here, some of the earliest forms of life are germs, but no one knew. They could not see them with the naked eye. So it wreaked havoc on human health. And when Semmelweis put the notice on the board, when you go from the morgue into the operating room, you have to change your apron, you have to sterilize your instruments, and you have to wash your hands. Simple procedure. The physicians, not understanding germ theory, said, okay, what's this new hospital procedure here? What are they coming up with now? It's always something to keep us busy, always some more workload to do. And they said, okay, we can let the maids change our, give us clean aprons. Okay. We'll delegate it to the nurses to wash our instruments, but we're not washing our hands. They refuse to wash their hands. Now, do you think this rested well with Dr. Semmelweis, their boss? No. He says, no, you don't understand. You have to wash your hands. Now, I would say, just as an example that I want to make here, I would say the physicians who refused to wash their hands had a mixed paradigm. They had an idea that part of what, some of what they were up to might be deadly, but not their hands. They're good people. They're not trying to kill innocent mothers. I don't know what this doctor is talking about. Leave me alone. Of course he wouldn't. So that's a mixed paradigm example. You understand what I'm saying? That they wouldn't wash their hands made that they couldn't see the 100% nature of germs. So they were unimpacted by this discovery. And it took many years, as I mentioned. Now, I'm saying that because there is today, in every community, in every household, every meeting hall in here and everywhere else, there's a lot of what I would call outside-in thinking. And what I mean by outside-in thinking is thinking, let me say it a better way. Outside-in feelings are caused by thought, because all feelings are caused by thought. From the worst, most horrific, terrible, negative, nasty feeling, nasty thought you've ever had, to the most beautiful, transcendent thought you've ever had, all those thoughts, all that thought is connected to feeling. And by and large, the population doesn't realize that. So we get exposed to contaminants in our minds that lend to an array of problems and issues and difficulties that are unnecessary and completely curable. But right now, we live in a mixed paradigm world about thought. It looks like thought is a player in some of our feelings, but not in 100% of them. And I'm here to tell you it's a 100% deal. And if you can accept that and pick a paradigm about that, settle on a single cause for the way you're feeling, whatever you're feeling in the moment. When you get that idea, as I have, I started looking at myself and my colleagues and my family and friends through a different lens. And I realized that the question that arose for me with understanding the principles was, where do I think my feelings are coming from? That was like a really simple but profound question. Where do I think my feelings are coming from? And there was really, you can decide where you think your feelings are coming from, but it's really a no-brainer. It's not rocket science. It's coming from the thinking you're doing in the moment. It can't come to you any other way. The feeling, the attitude, the state of mind, the experience. Love, you can't think love and feel hate. You can't think hate and feel love. You have to, the feeling is always synchronistic. It's always connected to, it's always determined by thought in the moment. The power of thought in the moment is connected to all feeling, positive or negative. And that amounts to what I think is a discovery made by Sydney Banks of, that's equally important as germ theory. We have some videos I'm going to show you in a few moments. And the CEO of a major hospital, we got the chance to talk with him, and we, meaning my colleagues and I, Joe Bailey, Sandy Crott, Valdo Monroe, we got the chance to work with this team in the hospital. And this CEO was an amazingly bright guy, and he picked it up right away. He said, "Oh my God," he said, "this is more important to medicine than germ theory." No, when he said that, I could have kissed him. I thought, well, there's somebody that really gets what I'm trying to say here. He's like on board. He's like big time on board. He wasn't just kidding around. He said, "Wow, this is incredible." And I said, "I know, but tell me more about what's incredible." Like, it was so nice to hear another person, you know, of his stature get it after such a seemingly rather short while. You know, I think for me, breaking it down to a simple discriminator had afforded me a chance to talk more specifically and simplistically and accurately and just keep pinpointing it. Because when it dawned on him, he could see then the implications of that. It wasn't like my idea, it was his truth too. So it wasn't anything I had to sell. He, as a scientist, recognized the scientific truth of that. And it wasn't anything else that he had to, it was an insight, but it became his insight. You know, it was Semmelweis's insight, but, and it was a while before someone else connected to Semmelweis's insight. And when they did, then he had a colleague, right? You know, and then the colleague started building out. Now there's millions, not only colleagues of Semmelweis's in medicine, but all over the world. Mothers, there's all kinds of colleagues. But at one point, not that long ago, there was nobody. So that's a parallel example of the simple truth that feeling and thought are connected. Now, here's the other thing. When you don't see that connection, and believe me, there's a lot of times you don't, it's not a problem. But if you understand the truth of it, you will become more resilient. And here's why. Because, you know, I said throughout human history, human beings have been resilient. Well, you already know this. You've already noticed that your thought, the way your use of thought has had an impact on your feeling. That's not foreign to you. What's foreign to you, as I said the other day, is that it doesn't look like 100%. It looks iffy sometimes. I'm telling you, it's 100%. You might as well be saying, well, germs aren't 100% deal. They're, you know, they're around, but they don't really have any impact on me. It's not true. We live with germs. You know, we can't we don't have a life. We don't have the possibility of a life without germs. We don't have the possibility of life without the fact that our use of thought creates a feeling. It has a well, it shouldn't say it that way. They coincide. A feeling is thought. They're inseparable. Now, when you falsely separate them, you create an illusion. You create, the reality is, it's like this. Thought and feeling are like that. But when you don't see that, it's not a belief, it's a scientific truth. But when you believe otherwise, you believe other than the truth, you can seemingly, although it can't happen, you can believe that it works some other way. There's some other way that your feeling is coming to you through some other means. And it might be circumstances, situations, your past, etc. That's not true, but it can look like that. And if I could apologize for all of my colleagues, I would, because we've all been sold a bill of goods that it works some other way, and we've been innocently spreading disease. So there are medical people. Now here's the deal. We got this opportunity, and it was a unique one because we've been understanding this as a paradigm. And as a paradigm, it gave us a simpler way to talk about the principles that we found to be easy and simple, but impactful. And so we got this opportunity, and one of the things that is a huge problem in life, but in the medical community, the medical field, is a thing called burnout. Burnout's a terrible problem. Burnout affects 45 to 55% of the healthcare professionals in the United States today are burned out. Not just stressed out, burned out. All right? Burnout leads to a lot of medical errors. It has a terrible problem on teams. It has a terrible problem on physician health, welfare. It's a terrible condition. You might liken it to death by infection, wounds, or childbirth, or surgeries in 1847. It has a devastating effect on human life today. And the principles reveal why it's unnecessary. There's a lot of unnecessary, you might say, suffering. Okay? And we're here to do something about it. We're here to shed light on what's happening, and what can you, medical professional or not, mother, whoever you are, you have occasions, just like I do, just like anybody does, where they forget that their feeling is coming from their thinking in the moment. It's that simple, but you forget it. If we could do something to heighten our understanding of that, what starts to happen is things like this, like I'll be driving along sometimes, and I don't notice it, but I'm grinding. You know, grinding. You ever grind? Like, you know, it's kind of like in your mind, you just got something stuck in your craw, and you're just turning the wheels on. It's like trying to crunch up gravel in your blender or something like that. It's just, oh man, it just makes a racket, and it doesn't work, and it's just, the blades get worn out, but you just keep going, you know? And you don't notice that you don't really know what you're doing. You don't really realize that you've got something, some thought, and it's causing a feeling, and you don't notice that it's coming from your thinking in the moment. It's not caused by the gravel, it's caused by the activating the button. You know, you can have gravel, you can put all the gravel you want in there, but when you start chewing on it, it starts to turn into a state, and that state turns into a feeling. It turns into an experience. It turns into me driving down the highway going, "Rrr." Now, I know you've all had that experience, and probably many times along the way, sometimes, you would go, oh. You would wake up. You would see, oh, never mind. Never mind that. And you would change your mind. And when your mind changes, you just let go of that pain and suffering. And it might be a short while later, someone would say to you, hey, I'll give you $5 if you could tell me what you were grinding on back there. And you might even say, oh, I have no idea. I couldn't even recreate it. It's disappeared. It's gone off my mind. Now, that's a moment of resilience. Now, so what we decided to do with this hospital was to teach resilience. So when we proposed this to the person you're going to see on the screen in a minute, he says, oh, we've got professors of resilience. We've got people who've written books on resilience on our staff. Who do you guys think you are to come in here and say, you can help us with resilience? We've got programs on resilience. So I said, well, okay, show me your programs. So he pulled out a list. He's got a list. Here's what we do. Now, here's a couple things that I knew. One is, if you split thought from feeling, you create a doing. You have to do it. It's not possible to split thought from feeling. See what I mean? But if you think it is, then you're going to have to get back you're going to have to unsplit the unsplittable. You're going to have to resplit, you have to recombine the unsplittable. Well, it's unsplittable in the first place. But now you've got a method, so I know methods are going to be of that misunderstanding. So I look at the list, and it's got all these methods that they give to their physicians. They've got mindfulness, we get techniques and methods. And one of the things that I know too, Sid Banks said years ago, a technique is saying that it's not inside. It's inside. He says, I'm telling you right now, it's inside. So I see mindfulness, and I think technique. And I see cognitive behavioral therapy. I think that's a technique. I see heart math. That's a technique. I see this list. And it's a list of methodologies that they prescribe. They had a prescription list. So a doctor comes in, burned out, and they say, oh, okay, number 3, take this and call me in the morning. Kind of. That was their thinking, see? But they had the model that it wasn't a paradigm problem. They had the idea that it was a personal issue. It was, they had the idea that it was curdled milk. See what I'm saying? Or that it was birth position, or that they thought it was something that it wasn't. So they're prescribing methods. And so I said, well, these are paradigm problems. And he said, well, what's your technique? And I said, well, that's just it. There's no technique. There's nothing broken in the first place. And he said, excuse me? And I said, so I went on to explain, We did, Joe and I, and he says, wow. He said, every one of these has got something to do. I said, I know. You have to have something to do if you've split the unsplittable, you know, because you created an illusion about what's the matter. So he says, you know, he said, before having this conversation, he said, I had decided I am not going to buy one more resilience program for my people. He said, every single one of them puts more on their plate. He said, they're already burned out. They're overworked and overwhelmed. I bring in a program and now they got homework to do. He said, God bless them. He said, I just decided, that's it. I've done enough of that. And it was like he had kind of gotten to the end of his rope on giving his good people more to do and think about and try to be better. Because they're good people, they're wonderful people, they're bright people, incredible people. But they had a problem with burnout, and they weren't very resilient. They didn't know the resilience that they already had experienced. And so we said, well, there's no technique, there's nothing to do, no homework. He said, I'm buying it. That sounds terrific. And then he says, then we got a call from the research committee. And the research committee, there's a beautiful hospital because they research everything. They want to, and we were like, wait a minute, you're going to do research on our program? And they said, oh, we would do research on every program. And we're like, thank you, God. Like, it was like, because we never met a client that said, oh, we'll do the research. We'll do this. We'll get the subjects. We'll find that whatever tests you want to apply to, give them. We'll help you administer them. We'll sort the groups out. Oh, and we've got to have a control group. And I thought, then I really wanted to kiss them, because I thought, you've got to be kidding. You're gonna want a control group like we've always wanted a control group. I see my colleagues over here going, yeah, we've always wanted a control group. It's been 40 years. But doing research is incredibly expensive, and it takes a lot of effort, because essentially you have to withhold treatment from one group. You have to do all of that, get those measurements together, get the pool of subjects together. And we're not there yet. I'm not going to show you any data, because here's the other thing, is that it moves at glacial speed. It's unbelievable. And I don't have data. I've got preliminary data, but all the numbers are going to change. And plus I have contracts with the hospital, and they want co-authors. They're going to have, can you believe this? They're going to co-publish with us the results. So it won't be just Joe and I on the paper. It'll be faculty from this medical center. And so we're like, thank you, God, again. Like, it's like unbelievable. They've devoted their entire medical team to this. They want to find out, does this work? And believe me, the preliminary results are, it works. It works really good. So the research committee calls us and says, now they don't really know what the CEO knows. So they're kind of in a mixed paradigm world, see? So they say, we were looking at your proposal. We wanted to fold it together with mindfulness. We wanted to do, one of them loves mindfulness. So I'm all of a sudden, I'm like deer in the headlights. I'm on the phone, Joe's there, And Valda's in the background. And so when they say, Valda's my wife, Joe's my best friend. So when they say they want to combine it with mindfulness, I don't know, I'm stunned because I think, oh, this is not going to work, you know? And Valda whispers, and she says, that's another paradigm. You can't mix paradigms. Two paradigms can't talk to one another. They have a completely different logical basis all the way down. They're incompatible, completely. And so I said, oh, but that would be mixing two paradigms. Now they knew that mixing two paradigms was incompatible and was impossible. You can't do it. It's just, it'd be crazy to do it. It'd be a waste of their time. They knew that by knowing the nature of a paradigm, because a paradigm has its own logic unto itself, and it is different from any other paradigm or any other non-paradigm. We knew when I met Sydney Banks, I thought, I think this guy's got a paradigm. And the first paper we ever wrote about this in 1978 alluded to this paradigm issue. We called it first and second order frame of reference, but they were incompatible. They were discontinuous. So the way Sid was thinking was discontinuous with the way we were thinking. See? And we kept trying to go, yeah, but, and he was like, no, you listen, let's start all over again. You're not listening. Well, we thought, no, you're being stubborn. Well, no, he's not being stubborn. He had a paradigm going for him. And we did it. It was like Semmelweis talking to his staff. And those books, you know, the Enlightened Gardener, well, those idiot psychologists that Andy's talking to, well, that's me and Bill and Dickon and all the rest of us. We were like having conversations with someone that knew a different paradigm. So those were difficult conversations, but challenging, but really, really valuable, incredibly valuable and important. So, that said, I think we should move to, so here's what, so no data yet. Data will be coming at some point. It won't prove the principles to the world, and then everything will just be hunky-dory from then in. We're just starting this deal. So it's going to take a lot of people on the ground, like it did with germ theory. It was decades before it got accepted. So, but hey, we're in on the ground level of a very important evolution. So we could, yeah. So here's the CEO, here's a few staff talking about what they saw in a very quick amount of time, I might say, about what the implications are of understanding the resilience paradigm. That's how we taught this. Now, if you want to ask questions, don't ask me about the data. Ask me, how did we teach this as a paradigm? Because that's what we did. We didn't teach it any other way. We came at it with a paradigm logic of a single discriminator. Where do you think your feelings are coming from? And we kept to that. And we showed them, to their satisfaction, that thought has something to do with every feeling. We haven't done this before, so I don't know how this is going to show up, but with our master of technology, Svi Werder.
Just on healthcare for a minute, we have the potential to redefine the entire equation. So again, mostly in the US, but you can all think of your respective countries. healthcare is not healthcare, it's sick care. We're taking care of people who are sick. And if you ask them what they want, most people who are really sick wish they had never gotten sick. So what if we begin changing the conversation and focusing on what is true health care and wellness, and why not put all the brilliant minds that are figuring out the next treatment for cancer, which is incredibly exciting and incredibly important, but what if we're also thinking about how to prevent cancer? And what if we're thinking about how to avoid needing that major surgery, the next liver transplant, the kinds of things that we're very renowned for at the Mayo Clinic? Those are wonderful and important advances, but we're envisioning a place where people are able to bring their best selves to the workplace and think innovatively and differently about all sorts of problems. And we've already seen that the cost of healthcare can drop without lowering and in fact increasing the quality of healthcare. So Joe, to your point, I mean, I think that there's this opportunity to have this tremendous transformation of healthcare, and then how in each of our domains do we help to make society a place where there is less bitterness, less anger, less frustration, less cynicism, and more focus on solutions to societal problems. And we have a tremendous relationship with a whole host of universities, including Karolinska University, University of Minnesota, Arizona State University, where we want to have those conversations. We want to work in the biggest playing fields that are available to say, how do we make the world a better place? And to me, the principles are going to need to be a significant part of that solution. Sometimes it's these technical innovations, but to get to those technical innovations, we have to be at a place where we're not distracted, where we're able to bring our best thinking to the problems that we all face, whether it's in a classroom, in a hospital bed, in an emergency department, or in society. So I mean, I do think this is an incredibly exciting time.
I think I'm not a psychologist and I'm not a psychiatrist, but I think a lot of our thinking, space in our thinking, is the private conversations that we have with about events or people that we interact with. Things that we didn't say, what this person really meant, or why they're doing this, what maybe I should have done that. So that conversation, I would say, is completely inefficient and probably unproductive, and doesn't allow you to have real conversations with people. So when you interact with a patient, with a colleague, with your wife or your partner, your children, to listen to that in a very unbiased manner. I mean, we're biased. I mean, we always have a thinking and a feeling going on. We cannot avoid it. It's part of our programming as human beings. But being aware of that, you are more open to what the person is saying or is really happening. So you're really in the moment then. You're not somewhere else or contaminated by those thinking, and that most of the time is rumination that is not very productive and harmful sometimes.
Which also causes stress.
Yes, of course. Yeah, because you are carrying two conversations, the one in your mind that you bring to the conversation plus what the person is telling you. I mean, at least two, maybe more conversations. But you have too many, maybe you should see a psychiatrist.
Great example. In fact, it happened about, 3 or 4 weeks after the course. I get a phone call. It's from an operations administrator who will remain nameless, who generally calls and talks to me, and when they are letting me know things, it's needing that constant affirmation that they're right and that I'm there with them, I support their decision, but they want to be micromanaged. So every time they call, my initial response is, oh, there's so-and-so. he just needs to be stroked again. I just need to, you know, he's just going to be telling you about some minute little detail. Here we go. That would have been my response. After the course, I got a phone call from him. And believe it or not, my response, I answer the phone. As I'm answering the phone, my response my thought process in my mind is no longer about me and about how inconvenient that is that he's calling me. It's, boy, he's in trouble. He's having stress. I know he doesn't want to call me about everything. I know this is a difficult decision for him to have picked up the phone and called me. And in that interaction that we had, I don't know whether the outcome would have been the same or not. I have no idea. But I know that the way I viewed him and the way I viewed that interaction was distinctly different. And it was a much clearer view of that interaction, what it meant to the two of us, and mostly what it meant to me. Because I now had a lot more empathy. I had a lot more understanding of what was driving him. Consequently, in the last few months, that relationship has gotten better and better. He doesn't call me as much. And I'm sure he's getting that subliminal message from me that it's no longer a nuisance, it's no longer an issue, and I think he feels freer in that regard. Now, I've not had the conversation with him about it, but at least in my mind, I've noticed a distinct difference.
I can tell you, so this little crisis that we're having at work, and I've probably met with about a dozen staff over how they're coping with this and trying to help them through this, help my team through this. And I can tell you the response I get from everybody, and even just my written messages, I think, and my verbal messages, is that it has helped people to talk to me. That it has helped them understand what's happening in the organization, to talk to me, and that my messaging has been very helpful to them. And I think I'm able to be an effective communicator and effective providing messages because of how I'm approaching the situation. So I don't think they realize, obviously, that it's resiliency that's helping me do this. But I think internally it is resiliency that's helping me process effectively, causing other people to want to have my advice, my input, and solutions to help them move forward.
So in that environment, to declare ourselves to be burned out in such a large proportion is something really worthwhile to look into why that is happening. So I was very pleased to see that our leadership at Mayo Clinic in Arizona and Mayo Clinic and our Department of Human Resources have looked into this and developed this seminar on resiliency. And I define resiliency as the ability that we have to respond to stress or adverse events. And that is more than, it's not a trait that we carry, but it's a process that we can develop. And I participate in this, not only because I also live stress in my daily life, in terms of my work, treating, seeing patients, and also in my leadership role, interacting with colleagues or other professionals. And sometimes I don't take that well. I didn't take that well. So this seminar gave me the opportunity to look into that. And what was for me very important, that the seminar, and that's why I encourage everybody that I talk to take it, is not about acquiring a set of tools how to manipulate reality or other human beings, but getting in touch with the essence of who we are as human beings. And realize that stress is part of life, and dissect how that stress reaction happens. So, and you will see in this, my colleagues who are taking the seminars, or healthcare personnel taking the seminar, will realize that a lot is talk about the inside-out paradigm. And I'm not going to tell you in a few words what it's about, because that's the purpose of the seminar. But to realize that every emotion we have, every feeling we have, is associated, is linked to a thought in the thinking in the moment, and that I'm the source of that, and not somebody else saying that to me or doing that to me, because telepathy hasn't reached that level of development yet, it was a major discovery. Because it's a discovery because we have it. It's not something that I learn, it's something that I have. And realizing that is what I have is very powerful, allows me to face, and since I did the seminar, to face situations that are stressful, interaction with patients or colleagues or other people I meet in my life, in my personal life, that could be sometimes stressful, not ideal, to realize that I am the one that is reacting to that or thinking that or feeling that. And then I can have the opportunity to change that, or just realizing that that's what's happening. We are open to the possibility that maybe what we are interpreting coming from that person is not right. That the person has his own set of thinking and emotions in my interaction with me. So that's why I think this seminar is very powerful, and I consider it to be the two components.
Resilience is something we've all experienced. It's not, we've had the wrong paradigm about it. We've had a paradigm that thought's not involved with resilience. It looks like, back to the germ thing, it looks like it's personality, it looks like the past, it looks like strong people. In the resilience research, it's all about strength factors, it's all about risk factors, it's about upbringing or the past, it's about certain circumstances, certain personalities. We haven't we've had no idea what resilience is. It's been a chaos because we've had no paradigm of the principles. The paradigm of the principles has been missing from our investigation, so we've attributed it in a mixed paradigm way to people, personality, other factors. You see, it's just exactly the same as it was with germs. So we've been in an ignorant, a mixed paradigm. We've had mixed paradigm eyes to study the phenomena, and it looks like something that it's actually not. Now, if you see the world of thought as a constant, it's a constant. It never changes. It never varies. It's changeless. It's neutral. It's omnipresent. There's never a time that thought isn't there. It's always there in your mental life, birth to death. In that simple assertion, we've never had a constant in mental life. Never. That's a different paradigm. We've never had consciousness as a constant. I'm not talking about your consciousness or or my consciousness or high consciousness or low consciousness. I'm talking about consciousness that was in existence before the human experience. Eternal consciousness has never been a factor in our mental life. Same thing with mind. I'm talking about personal mind or impersonal mind or personal thinking, impersonal thinking, all these differentiations. There was no way for us to talk about the principles before without splitting them. And when I saw them as a paradigm, I had because they're, as Sid would often say, I mean, you can't have reality without mind. You can't have reality, you take any one of these away, it's like a three-legged stool, it just collapses. They're all three co-equal, co-partners, co-principles. So if you can see them as whole, you put thought back together, put mind back together, put consciousness back together, and think of it as a true paradigm. This has been a way that has gone right into the medical community, and we didn't know it would. Like when we first started, as our first talk with these classes, we said, look, this is, and we had world-class neurologists in the room. We said, this is not about brain. And they're like, okay. We thought they were going to say, wait a minute, what do you mean it's not about brain? Everything's about brain. They were like, they could dig that. They could get behind that. They wanted to hear what we had to say. They were very respectful, very sincere, genuine scientists. And they weren't frightened. They weren't insecure. They weren't judgmental. They were wanting to hear us out. And we said, it's not about positive thinking. And they were like, okay. You know, they were remarkably amenable, surprisingly amenable to us, because we weren't used to so much respect. It was very cute, too. Like, another thing that was really struck me is we would do coaching. So we did classes and coaching. And the coaching would be done over the internet. So, like if I had an appointment at 11 o'clock, I'm telling you, exactly on the dot, every single person, 11 o'clock, they're there. They punch in the button. They're on screen. And this is just one example. One ophthalmologist woman, a Chinese descent woman, says, the first words out of her mouth, first coaching session is, my mother's driving me crazy. What can I do about it? I mean, they were so real and so honest and so wanting to get more understanding. So they were just the model of people to work with, which was thrilling and very powerful. Another person now they took the classes, but the classes didn't really do it for them. They thought, okay, you know, I mean, they were just kind of hearing it. But then the coaching sessions, first coaching session, he tells me a story. He says, these young people today, the medical students or whatever, they don't have, essentially this is what he says, they don't have respect. They see me in the hall and they're on their phones. And they don't even know who I am. They don't even bother to greet me. They're all into their world, you know. And I said, well, could I ask you something? He said, oh, of course, yes. I said, I gather that you are offended by them. And he said, well, absolutely, I'm offended. And I said, well, let me tell you a story. I knew someone once that read an obituary. And in the obituary, it said this woman was never offended because she never took offense. And he says, whoa, you mean you have, he says, of course. Like right away, he's like, of course, you would have to take offense to ever feel offended. Every single time I've ever taken offense, I've thought offended. He says that's what the courses were about, of course. Just cleared up his whole issue with the younger generation and their phones. That was it. He was on to something else. He had the insight, saw it, and he's turned into a big advocate. But you can see why, because that was it was like a thorn in his side. Every time he was outside of his office, he was encountering these irritants, these bothers, and it was taking a toll on him. One of the time I remember Sid saying once, I says these wee little. He was Scottish descent. And he says these wee little things. And he meant these little tiny, like that little tiny thing right there, taking offense. That was part of his daily diet, right? And now you have 50 other things where he doesn't get where his feelings are coming from. And you guys know what I'm talking about because it happens to you too. right? That exacts a toll. It gives you more to think about. It gives you more to deal with. It complicates things. It gets you out of the moment. It pulls you into this, pulls you into that. And as that happens to you, you get more stress. And you have to. And then, they further realized that getting outside in about the fact that they're outside in made no more sense to them. See what I mean? Like if you can't treat outside in by judgmental, you can't get down on yourself, you can't get down on other people, you can't judge other people for the same. Why? Because you do it too. What's the sense of judgment? It makes no sense for the future of the world. We're going to lose our taste for it because we suffer it. You're the first recipient of your thought-created feeling, not the other guy. You're living in that feeling from your own thinking. So it's wonderful to be able to share this with you. And thank you.